Well, this study was so it's a town in some settings of lying up patients report moderate to severe pain after surgery. Now, what modern analgesia is what's being recommended as the set of standard periodic pain management. However, in Uganda, studies done about 10 years ago to show the power use is really low, up to about 14% with patients. However, this study focused on after surgery, so we didn't know what happened before and during surgery. Yeah, so we enrolled 449 patients undergoing major surgery. We did was abdominal, thoracic, spine, limb surgery. So we recorded all the analgesics before, during, and after surgery. And we followed them up for 6 hours. Every 6 hours, 10 hours after surgery. And so what did we find? So over here is a breakdown of the use of multimodal analgesia. So we see before surgery we had a very low use on multimodal. It increased during surgery, it was highest after surgery. However, most patients were getting just acetaminophen and opioids. There was little use of NSAIDs, little use of Mulago analgesics, and in this cohort, no patient got a real opportunity. It's less than 50% of the patients got their MMA as prescribed. So there were lapses regards dosage and frequency. So when we did the pain scores, we realized that about 94% reported moderate to severe pain, and there is a breakdown. So severe pain is highest at 0 hours, then moderate reducing up to 24 hours. When we did the associations, all that MMA has been noted in this table, no concluded pain control after surgery. And the factors that positively predicted use of analgesia were history of chronic pain, and if a patient got a neuraxial anesthesia, they are management. Yeah. Then those that negatively predicted MMA use was thoracic surgery, and providers who were between 5 to 10 years of practice. Yeah. So we conclude that MMA use was common during and after surgery. Our regimens rarely went beyond paracetamol and opioids, and then prescriptions were seldom adhered to. So the next steps in the study really to understand what are the challenges to the implementation of regional blocks and neuraxial analgesics, and also to the use of non-opioid analgesics such as NSAIDs. And I think now it's important that we adopt self-administered analgesia and to adapt the MMA protocols to the local setting. Thank you.